Now we continue like so with with the discussion of the procedures, and we've already discussed why it's important to obtain consent and to introduce yourself. And why is it? Why do you need to prepare the trolley? Iham is joining us. So yes, Kadon, please.
Because it's necessary equipment needs to the to the present, and it's also missing instrument in the middle of a produced may cause problem.
Yes, to have everything on hand,
Yes.
all the tools, medical instruments. Good. And now, if we look at the following slide, here is here you can see some steps from the instructions for procedure, and you can see the gaps, and we should complete the gaps with the words given above the sentences, like the verbs prepare, mark, attach, wash, sterilize, drain, obtain, withdraw. I think you understand the meaning of the words, like attach means to connect, to tie something together. Like obtain means to get, to withdraw is to take away. Yes, Iham knows what should we use in the first sentence. Iham?
The first one about the stylet, we can use the withdraw.
Withdraw the stylet.
Yeah.
So, the stylet, do you know what the stylet means? What is it? What kind of thing the stylet is? So actually, a stylet is a catheter or tube. And yes, so it can be attach the stylet or withdraw the stylet. So they're opposite. Okay, what about sentence B? Yes, and in sentence B, we can see the abbreviation CSF. It stands for, if we can look down, cerebrospinal fluid. And in line C, abbreviation is L304. This is lumbar vertebra. Yes, Mathir, what should you write in B sentence?
Is it withdraw 10 drops of cerebrospinal fluid into 3 specimen tubes?
Possible. Or yes, this is the sentence about just taking some sample of the substance from the body of the patient. But if we speak about liquids, because this is fluid, if we speak about liquids and so drops of liquids, it means that it doesn't flow very fast. What is the other the better word here?
Can I answer?
Yes, Seyhan, please.
Miss, we can use drain.
Drain is better to use here, yes. So withdraw is possible, drain. Okay. Now, if we look at sentence C, this is the point between vertebra 3 or 4, where the needle is to be inserted. So we can see that this is about inserting a needle inside the body of the patient, and about, as far as this is a vertebra, so Abdullah Yunus is joining. This is the back of the patient's body. Lina, yes, what do you suggest to use here?
Mark the point between lumbar vertebra 3 and 4 where the needle is to be inserted.
So to mark, so we can understand where the needle should be applied. Now sentence D, Yes, sentence D, and Kadum, please.
You can use wash your hands and put on sterilized gloves.
Yes, this is obvious thing. You should wash your hands. Wash your hands. Abdullah is. And who else? Abdullah and Abdullah. Abdullah. Okay. And consent for the procedure, line E. So is Yasmin here?
Yes, I'm here.
So what do you think, which verb should be here in line E?
Consent for the procedure. Maybe to obtain consent for the procedure.
Obtain consent for the procedure, yes, from the patient, agreement. So the patient gives agreement for the procedure. Okay, so the next is the area of the patient's back, and Abdul Yunus, please.
Yes, F, right?
Mhm.
The area of the patient's back.
What should we do with the area of the patient's back? Yes, Yunus. Hello. Abdullah Yunus.
Oh, it's sterilized.
Sterilize.
Yeah.
I see. Okay. And the equipment on the trolley. The equipment on the trolley. Yes. So who else? Ayhan, please.
Miss, for the equipment on the trolley, we can use prepare.
Prepare, exactly. And the final step, not maybe not the final.
Also for me,
Okay, yes.
attach the manometer.
So this is attach the manometer. Manometer, the picture of the manometer is on the same slide. This is the instrument that shows the pressure of some liquid in the body. We can control the pressure of the liquid, and you can see the needles, or maybe syringe. Yes, needles, and so the tubes, specimen tubes here, the pictures of these equipment. And yes, if we move to the next slide, we can see all the verbs are already in the sentences, like withdraw the stylet, drain 10 drops of fluid into the tubes, mark the point where the needle is to be inserted, wash your hands, obtain consent, sterilize the patient's back, prepare the equipment, and attach the manometer. But you can see these are not all the steps, some of them. Some steps are missing, but anyway, we can reconstruct the correct order of the steps. If we think about the correct order of the steps, we can't start with withdraw the stylet, because this is the final step, actually. What is the first step? What should we do first in this procedure? And we don't know what the procedure is, but this is the common way of doing something to start some kind of medical procedure with this. What should we do?
I think, Miss, for the first step is wash your hands and put on sterile gloves.
What about obtaining consent for the procedure? Is it important to do at the beginning of the procedure?
I think the washing of hands is the more important.
Okay, so yes, you wash your hands, and then with your gloves on, you come to the patient, and you ask him to sign the agreement, right? If it is a very serious procedure. Okay, possible. I think obtaining consent can be done as the first step. And then you can wash your hands and do what? So wash your hands and what is the next step?
Prepare the equipment.
Prepare the
Exactly.
equipment.
Yes, on the trolley. Yes, it's because you will use this equipment in the procedure. Then we've prepared everything. We washed the hands. Then
Sterilize the area of the patient bag.
which area? We don't know which area. Should we sterilize the whole body or what?
I think just the area that we need to make the
And where is it? How to find this area?
in the patient's back.
How to find this area? So
I think by
yes.
attach the manometer.
Well,
or not.
Abdullah Yunus, what is the next step?
I think it's the withdraw the satellite.
No, withdraw the stylet. This is the final step. Yasmin, what do you think should we do?
Mark the point, which is between the lumbar vertebra 3 and 4.
Exactly. So we should mark this point and then we sterilize the area at this point, around this point. Then we've sterilized the area of the patient's back. Then what should we do?
Drain 10 drops of CSF.
Of the fluid into the 3 specimen tubes. And when we drain the fluid, so we should control the process. Before this, I think we need to attach the manometer.
The manometer, right, miss?
Yes, because it shows the pressure. Then we can drain several
drain.
drops of fluid into the tubes. After draining,
And then withdraw the satellite.
sorry?
Yes, and then withdraw the satellite.
Withdraw the stylet. Yes, you are right.
Yeah,
Withdraw the
yeah,
stylet.
yeah.
This is the final step. Okay.
And
Now,
now
yes.
the bridger is complete. All the bridger is completed.
And what is the name of the procedure? Aham. You know everything. What is written in the book?
I think it is about.
Uh-huh.
I don't know really.
Uh-huh. Well, you see that this is just getting some fluid from the patient's body for analysis for the test as a test, and then this liquid will be analyzed, will be tested, and you can see that it's taken from the body with the help of needles. Yeah, needle is inserted. Well, actually, this is the procedure. It's called lumbar puncture. This is a procedure of taking fluid from the spine in the lower back through a whole needle, usually done for diagnostic purposes, a spinal tap. And you can see in the pictures how the needle should be inserted in between the ribs, yeah, and no, not ribs, but vertebra. And you can see the posture of the patient so during this procedure. Well, and now I would like, so actually this is that is all that I planned to discuss during this class. And before we start speaking about the test, I would like to revise, yes, some information, some terms together with you. Yes. Well, anyway, we need to go here, like, just a minute. So we are going to do this in the form of quest, And so we will be just moving inside the maze and answering the questions. Can you see the first slide?
Yeah,
Full
Miss, question. Miss.
Yeah, miss.
Is it full screen?
No.
No,
No.
okay. So I need to do it one more time. Mhm. Here it is. Well, you can see.
Yeah, no, it's full screen.
So questions maze. Welcome to the questions maze, and our aim is to find the center of the maze. And we should choose the correct answer to the question to go the right way. If you make a mistake, you might get lost. Now, let us begin our journey. And we have two options to turn left or to turn right. And we should answer this question. Which medical job involves implementing standard policies and procedures that keep the practice running smoothly? They supervise the facilities office staff, hire and train new staff members, and manage finances and budget operations. Well, Mazir.
Is it the practice manager?
Practice manager. Do you all agree?
No, the general practitioner, because the practice manager is just in the first day or something like that.
Okay.
So the right way.
Let's try like this. General practitioner?
Yeah, Miss.
No, I didn't. Click here to start again. It's wrong. So, Mazir, you are right. This is practice manager. Yeah, and it opens us the other step, and we should answer the question, give definition. This is a person who greets and deals with clients and visitors to a surgery office, etc. Is it health visitor, receptionist, or practice nurse?
Receptionist, of course.
Receptionist, of course. Okay, Denis says. So we should turn left. Right, okay. The next is, this is a doctor who treats patients with minor or chronic illnesses and refers those with serious conditions to a hospital. This is general practitioner, and we go straight ahead, or midwife, and we turn right.
I think the general practitioner.
General practitioner treats patient with
Yeah.
diseases. Okay, and this is a trained nurse who visits people in their homes to assist or advise the chronically ill or parents with very young children. Lina, please.
It's the health visitor.
Health visitor. Okay. Yes, you're right. Then this is a person, typically a woman, who is trained to assist women in childbirth. Is it midwife, receptionist, or
Midwife.
midwife?
Is it
And
midwife?
we
Yeah.
should go straight ahead. Well, this is a nurse who visits and treats patients in their homes, operating in a specific area or in association with a particular health center. Is it a practice nurse or district nurse?
No, the district nurse.
Let's check. Yes, you're right. This is a registered nurse based at general practitioner surgery office practice who works with their GPs to care for the patients seen at the surgery. Yes, my dear.
Is it the practice nurse?
Let us check. Should we turn right? Yes, good. The next, well, definition. This is a chronological written account of a patient's examination and treatment that includes the patient's medical history and complaints, the results of diagnostic tests and procedures. Is it presenting complaint or patient records? Lena?
Patient records.
Okay, we should turn left, yes. This is the list and description of the health problems and issues experienced by the patient resulting in the attendance. Yes, Lina?
I think it's the hospital number.
Okay, let's check. No, I didn't. So click here to start again. Well, so from the beginning, you are at the entrance. So this is medical jobs. What medical job is it? Who remembers?
Practice manager.
Okay. Who greets the clients?
Reception.
Receptionist. Doctor who treats patient with minor chronic
The
General
general
practitioner.
general practitioner. Trained nurse visits people in their homes to assist advised chronically.
Health visitor.
Okay. Woman who is trained to assist women in childbirth.
The
Midwife.
midwife.
Midwife. Okay. Nurse who visits treats patient in their home, separate in specific area, association, particular health center.
District nurse.
Okay, and now,
District nurse.
yes, you're right. This is a registered nurse at GP surgery, works with the GPs to care for the patients.
The practice nurse.
Practice nurse. Chronological written account of patient's examination and treatment that includes patient
Patient record.
patient records and list and description of health problems. Why the patient comes to general practitioner.
Presenting completion.
Yeah, presenting complaints. And now, which condition do you associate with the sharp pain at the right side of the stomach? Is it appendicitis, tension, headache, or angina pectoris? Mazir.
Is it appendicitis?
Let's check. If we go straight ahead, yes, you're right. Which condition refers to pain that radiates along the path of the nerve, which branches from your lower back through your hips and buttocks and down each leg? So we have two options, a ureteric colic or sciatica. What is it? Ureteric colic or sciatica? Lina?
Sciatica.
Sciatica? Yes, you're right. Now, which condition do you associate inflammation in the stomach causing belly pain, indigestion, bloating, and nausea? Is it gastritis or cholecystitis?
Gastritis.
Sorry, will you repeat, please?
Gastritis.
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 Okay, yes, here we are. Congratulations, you found the center of the maze. Okay, thank you so much for participating in this journey, in this quest. So we've revised some terms and it will help us in just in taking the test. And if we go back to our the first presentation, here is the information about the test. You will find it on the Moodle site. You should log into the Moodle site and you can find their presentation there and the general medicine midterm 1 test. So the instructions are given there and you can see when the test starts, I'll change the settings. Just open the test for you. The test covers the topics and grammar structures from units 1 and 2. And there are 33 questions in the test, and there are 4 types of questions. So it means that most of the questions are multiple choice questions with only one correct answer. You will see a sentence, for example, with a gap, and you will see several options, like 4 or 5 options, and you should click on the correct option, which is better to use in the sentence instead of the gap. And so most of the multiple choice questions in the test are grammar sentences, and you need to choose from the different grammar forms of verbs. Then there are some true-false questions. It means that you should decide if the statement which is given is true or false. And you click on one of the options on true or false. Then matching questions. It means that there'll be several terms, and when you click on a term, you'll see the dropout menu, and it shows the possible definitions for these terms, and you should choose from several definitions. And you should match each term with its definition, for example. And select missing words. You'll see short text on the screen, and with several missing words, with several gaps, and you should click on the gap, and you'll see several words, and you choose from this list of words the best one, the best phrase, and then you go to another gap and do the same. At the end of the test, you should don't forget to click the save button or submit button. I don't remember actually. And the time for the test is 50 minutes. It means that now it's about 1:30 Almaty time. And I'll go to the Moodle site, and I'll change the settings, and I'll open the test for you. And the test will be open for 2 hours. It means 1:30, and it will be 3:30. Yes, Almaty time. And during this time, you should, you should start immediately after I've opened the test. And when you start, you will see the time countdown, and you will see that you can do it only during this time of 50 minutes. And you will see how much time left till the end of the test. And so when you have finished, you submit the results, and you will see how much points you get out of 40. Maximum score is 40 points for the test. So that is all just about the test. And now give me 5 minutes to